Today we're talking about facial reconstruction and rejuvenation, but specifically rhinoplasty. Dr. Daria Hamrah is a board-certified facial cosmetic surgeon at NOVA SurgiCare and is here to tell us and show us the dramatic difference one operation can make. Welcome back.
Thank you. Thanks for having me.
You know, you do such great things at NOVA SurgiCare, and you focus on the face. Rhinoplasty is what we're going to focus on today. Tell us about, you know, I guess people get the wrong impression that it's only for, I guess, cosmetic, but it's for medical reasons as well.
Well, absolutely. Well, first of all, rhinoplasty is probably one of the most challenging surgeries when it comes to cosmetic surgery, just because there's so many variables, and it's a very technique-sensitive surgery. And it's in the center of patients' faces, so we take a lot of attention to it, and also as a surgeon a lot of pride when doing rhinoplasties, in particular since it can change patients' lives. And,
absolutely.
As far as the functionality of the nose, obviously it's important for the breathing. So a lot of patients also have breathing difficulties, and those problems can be solved all at once. You have breathing difficulties and you want to reshape your nose. They can be done at the same time, or you just want to reshape your nose because you think that your nose is either too big or too bulbous or crooked. All that can be fixed. And typically, you know, the rule is that form always follows function, so you correct the function of the nose, meaning make the patient breathe better. The form and the shape usually looks also very pleasant.
It'll look a lot better. You were telling me earlier about, I guess, first-hand experience with your rhinoplasty. Tell me about
well,
that.
You know, I had an old basketball injury, and for the longest time I had difficulties breathing, and plus my nose was crooked to one side, so it didn't look very nice and sightly. So, but I didn't realize until after I had my surgery that how it could change my life. You know, I could do sports again. I didn't have difficulties breathing at night. My wife told me I'm not snoring anymore. So it really is a life-changing experience, not only as far as the appearance, but also as far as how you breathe and how it affects your normal life.
That's a big deal. So tell us about that. If someone comes into your office and they're, you know, maybe unhappy with the way their nose looks, how long is the procedure? And just walk us through that.
Well, there's different aspects of rhinoplasty. The nose is constructed of cartilage, of bone, and obviously the skin that's on top of it. And depending on what we're trying to correct, the surgery may take anywhere from 1 hour to 4 hours. The rule of thumb is I never leave the operating room until the nose looks perfect. So if there's any revisions to be made, they're done at that time. You don't want to have the patient come back after 6 months with an unhappy nose.
That's encouraging.
So, and that's why sometimes surgeries take even longer. It's encouraging for the patient, like you said, but also as a surgeon, it's very important that you have to realize that these little fine-tunings and corrections of the noses have to be done right the first time. So for the patient also in the post-operative period, it's important, depending on how long the surgery took, usually that's how long the recovery also will take accordingly. If the surgery takes only 1 hour, usually they can expect the recovery to be very short. You know, maybe a couple of days, 2 to 3 days, they have a Band-Aid on their nose and it comes off.
Oh, that's not bad.
If they had some surgery on the bones, maybe they had a large hump and they had to have osteotomies, meaning repositioning of the bones of the nose, then they get a splint. The splint comes off after a week, and usually after a week when the splint comes off, they can go back to work. Maybe they have some traces of bruising that can be easily covered up with makeup, and after 7 to 10 days they could walk into public and no one would know that they had a rhinoplasty.
Okay, so recovery time could be anywhere from 2 days to 7
to 10 days.
That's not bad at all. Now, your typical patient, you know, say it's a teenager who comes in. I mean, we've all been through it. Everybody's not happy with their looks as a teenager.
Sure.
Do you, I guess, try to give them a little counseling, or?
Right. Interestingly, you know, there's two groups of patients. One is the teenagers, and the other one is also the patients in there's another bump in their 30s and 40s. It's probably the ones that have always contemplated and were never sure enough or never had the courage.
The money to do
or
it.
the money to do it, and then eventually got to do it. So there's kind of like two bumps in those age groups. But as far as teenagers, it's very important. I'm very careful in not operating them too early just because of the psychological maturity, which is very important and it's key. A lot of teenagers, obviously I was a teenager myself, you were a teenager yourself, so we had problems, and a lot of them think that getting a new nose is a solution to all their problems, and it's very careful. So I have a very long conversations with them without their parents in the room and also with their parents together to see what is the primary reason. Do they really, how much do they expect of the rhinoplasty to do for them? And the other aspect is the physiologic maturity. You know, have they grown?
Still changing, right?
Exactly. So,
okay, before we let you go, I know you've got a special that you're offering for the holidays.
Correct. Well, you know, our special is essentially $1,000 off any primary rhinoplasty, which is a virgin nose. It's never been operated on.
Oh, that's good.
And that's our holiday gift.
Dr. Hamrah, thank you so much. It's always great seeing you.
Can't wait
to see you again. Happy holidays
My pleasure.
to you.
Thank you.
And we'll have more Let's Talk.